All right. Well, how are you doing today?
I'm good. How are you?
I'm good. So, do you just want to let us know a little bit about what you do and how you can help moms?
Yeah, of course. So I am a physical therapist, and I mainly work with infants. So babies, like zero birth to walking is what the age group I typically work with. I usually see people in person in Seacoast, New Hampshire, or virtually worldwide. So I provide infant physical therapy and like virtual wellness preventative services as well. Anything related to breast bottle feeding, lip tongue ties, head flattening, head preference, neck tightness, milestone delay, colic slash gas slash reflux, like all those different things that new babies might experience. I'm also a mom myself of two toddlers, so my house is a little busy and crazy. But yeah, that's what led me into this work too. So
Yeah, absolutely. Well, I'm so excited
yeah.
to be here. I know you're going to help so many moms. The first question that I do have for you is, was there a moment as a mom that shaped the way that you work with families now?
100%. So I've been a pediatric physical therapist for the past 6 years or so, mainly working with infants like post NICU. Out of the NICU is where I started with my pediatric physical therapy journey. And I truly thought that I was going to have an easier time becoming a mom because of the fact that I was so familiar with like baby development and like the struggles that, babies and moms go through. But I can say that I was very humbled. It was not what I expected. My first child, had some feeding struggles, and we had to syringe feed her. So that's when I really started diving into the world of lip and tongue ties and breast bottle feeding issues. And thankfully, we were able to resume breastfeeding at about 3 months old with her. And then my second also had some feeding struggles that further shaped and evolved my practice as well. So
Mhm.
through those experiences, I feel like it's made me a better PT and a better mom. So, and I really enjoy being able to help parents in that way too, like with the knowledge that I've been through it myself. So
Absolutely, especially knowing that as a mom, it doesn't always go like how you expect it. And so it's a really
yeah,
hard to go through that.
100%. Yeah.
Absolutely. So, leading into our next question, what are some common myths about infant development that you wish more parents understood?
So the biggest misconception that I really look at is having to do with tummy time. So a lot of the times when I talk to parents, a lot of the biggest concerns are revolve around tummy time because there's so much out there on the internet and like so much out there, like whether you're talking to like any other therapist, any other pediatric therapist or pediatrician or whatever. Lots of focus on tummy time. So I really like to take away a lot of like the misconception around it and the fear around it because a lot of times parents think that they have to have their babies on their bellies, you know, majority of the day practicing tummy time, whether they're screaming, whether it's stressful or not. And I just really like to emphasize that tummy time is not the end all be all position. You don't have to have your baby be screaming during tummy time. If it's a stressful experience for you and for your baby, then you're not actually getting the benefits of the position. And tummy time counts whether it's on your chest, whether it is when you're holding them on your shoulder, whether you're holding them on your lap, anywhere on you. It doesn't have to be on the floor, especially in those first few months of life. Eventually, we'll get them on the floor and everything. But I think that was one of the biggest things, like as a new mom myself, is that even though I knew the importance of tummy time, I found that like I was even feeling like I was judging myself because I'm like, I'm not doing this much tummy time with my new baby. Like I must be a terrible mom because that's
Mhm.
what we do as moms. We always blame ourselves. So yeah, so I really like to pinpoint that like there's different positions you can practice, like side lying, tummy time, lying on their back and working on like them looking at you and tracking you with their face, things like that. And there are different options that you can do to practice tummy time. And if your baby really doesn't like it, then there might be some further exploration that we can go to so that's actually enjoyable for you and your little one.
Yeah, well, I know that takes the pressure off of moms to know that there's other options and making it fun as well, because I know my son really struggled with tummy time. So it's definitely
Yeah.
an experience, I think, among moms as well.
Oh, 100%. Yeah, I think that like I've talked to so many parents that were like, I'll put them on their bellies and they just scream, but I'm trying to get to like that 10-minute mark or something like that. I'm like,
Mhm.
it doesn't have to be like that. It's supposed to be enjoyable for both you and them. So they can become a functional developmental position and help with those future milestones as well. So yeah, it's not your fault if your baby doesn't like tummy time and it's not anything you're doing wrong if you're not getting them on the floor, 10, 20 minutes a day as a newborn baby. So
Mhm. Absolutely. So, our next question would be, what signs should parents look for early on that might suggest a baby could benefit from physical therapy or feeding support?
basically, with it really depends on what that baby is going through. So, like, depending on like whatever struggle or ailment or condition that the baby might be struggling with, that's where like the symptoms come into play of like those specific things. But the biggest thing foundationally that I like to say to parents and to moms is that your mom intuition, that mama gut that you have, is that if there's something wrong, and you feel like that there's something wrong, like intuitively, and you have concerns, you might go to your pediatrician and ask about it. And if they brush you off, because unfortunately a lot of pediatricians tend to do that. I'm not saying like as a blanket statement that all pediatricians do that, but that's typically what I hear is that there's like that huge wait and see approach. Um, if you're noticing something earlier on, you can get a second opinion. Don't feel like you're wrong. Don't feel like your mama got like led you astray.
Mm.
Um, that's like the biggest thing that I like to say to parents is that if you feel like something's wrong, there's very well something could be wrong, and you can always get a different opinion on what you're questioning. So that was the biggest thing I would say.
Absolutely. So, how do you feel like a mom can navigate looking towards those resources?
So to find like different resources when you're a mom, and like that's where I really love the community that you're building as well, because I think that when I became a mom, I didn't really even know where to turn to.
Hmm.
Thankfully as a pediatric physical therapist, I was able to kind of like do my own research and like help my baby in that way. But like I still had like a lot of that isolation. I didn't have like a lot of like mom friends per se. Like I was like one of the youngest people in like my friend group that had babies first. So it can be very isolating. So having like supportive communities like this where you can be like, my baby is struggling with this. What can I do? Or like, I know for me, there is like local Facebook groups for moms of like, this is what my baby is struggling with, or this is what I'm going through. Are there any resources or things that people might have found helpful? So that's where I kind of found support. But I think groups like this are so amazing because like then they have like the experts like right on hand that people can reach out to as resources. There are definitely some credible resources online, but I like to say that like if parents are feeling that overwhelm and that stress from like whatever their baby might be going through, then typically being online is like the worst place to be. So it's nice when you can just go to like these communities that are actually supportive of you and your baby and looking out for your best interests.
Absolutely. I know whenever I was ever having doubts with my son, I would go to Google, but there would be like the worst case scenarios that would pop.
Hmm.
So I think having that trustworthy circle, especially here in the community with experts, you don't have to like flood yourself with so much worry and
Hmm.
take that pressure off of you that way.
Oh, 100%. Yeah, because it's like that whole Dr. Google experience is like, oh, like, your baby might be struggling with like a head preference, but all of a sudden you're worried that like something else could be terribly wrong, like that,
Mhm.
because Google like always comes up with like cancer or something like, crazy that it could not be related to that at all. So
Mhm.
it's great to have that supportive community that parents can just go to.
Absolutely. Well, thank you for that. I'm sure that will help a lot of moms as well.
Yeah.
So, how can parents tell the difference between a normal feeding issue and something like a tongue or a lip tie?
So, really, with feeding, so feeding is a whole new experience for both mom and baby. So, I
Mhm.
really like to tell parents that because I think that when I was first had my child, when I first had my first daughter, she had a lot of struggles. And so she had to be syringe fed when she was in her first week of life. And I think that had I known more about lip and tongue ties and oral restrictions and things like that at the time, I probably would have been able to like help her a little bit more easily at the time. But I think that also the biggest thing that I had expected was that breastfeeding was going to be this natural bonding experience that just came automatically once my baby was born. And when
Mm,
it wasn't like that, I felt very isolated and put a lot of that blame on myself and like thinking I was doing something wrong. Whereas a lot of the times it has nothing to do with the mom. A lot of the times it's like maybe there's some oral restrictions going on for the baby, and or they're just learning a totally new experience, a totally new way to like coordinate their mouths and kind of perform that feeding experience, whether it's breast or bottle feeding. There's a lot of that practice in the womb. Like they actually have like reflexes that they practice in the womb to help prepare them for that. But until they're actually practicing it themselves, like in like on, earth side or whatever, then it's like they don't really know how to do that until they practiced it. So there is like, general just getting used to that experience of breastfeeding and getting the mechanics down of it. And two, there are those oral restrictions that could potentially cause breastfeeding struggles, whether that's the symptoms typically revolve around like painful breastfeeding. So if it's painful when your baby latches on and tries to nurse, those like lipstick shaped nipples, like your nipples are kind of like flattened, meaning your baby's kind of like pinching and like smashing your nipple against their palate because they don't have that coordination and that positioning to latch onto your nipple properly. As well as baby might get really tired really easily because they're working so hard to maintain the latch. They might not be able to open their mouth wide enough to get a nice deep latch on the breast.
mm,
They might not be able to transfer the milk from the front to the back of the mouth to be able to get those good feeds. So sometimes they might have some slower weight gain or decreased weight gain because they're not getting the feeds that they need to. So those are some of the symptoms that might like correlate to some oral restriction. And I like to say to parents as well, just because a baby has oral restriction doesn't mean they necessarily have to like rush to a dentist to get a tongue tie release or something like that. A lot of times what I find is that they might have these oral restrictions, but it's actually connected to a lot of like the muscles within their face and the jaw, which can cause more of that restriction. So if we kind of release that tightness and that tension there, it actually helps a lot with feeding and the successive feeding versus necessarily needing to do a surgery if the parents don't desire to do that. So, yeah,
that's awesome. Yeah. So there's like more options than just a surgery, which is such a good thing
yeah,
to hear because I know that that can be like a big deal knowing that there's an issue there and rushing to the worst
totally,
scenario. So, yeah.
totally. Yeah, there's options for sure.
Yes. So, and then as far as head flattening or asymmetry, when should parents start to worry about that? And what are some things that they could do to prevent it?
So with the head flattening asymmetry piece, so the biggest things that I look for with like the head flattening and asymmetry is does the baby prefer looking to one side? And if you do, was it like a pattern? Have they been doing that since they were little? On that side that they prefer, do they have some flatness on that side of their head? So, or it could be a baby that if they're positioned on their back a lot, they might have some flattening like directly on the back of their head. So what I really like to talk to parents about is that causes of different head flatness could be that positional, what's called positional plagiocephaly, where a baby is in like a container, like a swing or a bouncer, or lying flat on their back very frequently and not kind of moving in and out of that position. Or it could be related to how the baby was positioned, like in the womb, in the uterus. That could have caused some of that flattening because babies' heads are very malleable because they have to be in order to get through the birth canal during birth. So a lot of the times, what that can lead to is some flattening after birth, depending on their positioning as well. So in order to prevent that, I do like to encourage, like, limiting your use of bouncers and car seats and swings, things like that when you can. And I'm also realistic, being a mom myself, and I definitely, when my babies did not sleep very well. So when they slept in like a bouncer, especially my first, I really took advantage of that. And in those situations, if you notice that your baby prefers to sleep in those different containers, just making sure that you're kind of balancing that out with doing some more time outside of those containers. So like being able to do some tummy time on you, on your chest, on your lap, potentially getting on the floor if you're comfortable with that. I know for me and my with my daughter, I would like if she wanted to nap in the bouncer, I let her nap in the bouncer, and then I might take her out and like have her practice in tummy time or sideline while I was making dinner or something like that, and then I could still see her. So things like that are really helpful. Other things, if you notice your baby has a head preference and that's where they're seeing that flattening, is like some just caregiver habit changes, which can be really tough because we all have our own preferences. So things like changing their diaper on the different side, switching the way that their head is turned in the bathtub. So like switching their tub around so that they're facing a different way.
Mm.
Doing like feeding in different positions, changing their other positions in the bassinet so their head is on the other side that they typically are. Um, and then, yeah, things like that are so, so helpful to make sure that yeah, they're getting that experience of really being on both sides of the head and really rounding out their skull.
So if a mom was to see some like warning signs that she maybe needs to change position more, when would you say that like changing the position isn't enough for helping that?
So for this specifically, that what is shown in the research is that there is a lot of if baby has like what's called significant plagiocephaly or significant flattening, then it's sometimes what needs to happen is that if they're at a point where they're maybe like 3, 4, 5 months old, it
Mhm.
might be helpful to start looking into a helmet, whether you get a referral from your pediatrician to an orthotist, and then looking into it that way, or you talk to a physical therapist and see what they have to say about it. Because of course, like as a parent, you're not going to know what is significant plagiocephaly or what is moderate or mild or whatever the case may be. I have found, even though the research shows that by 3 to 4 months old, you can't really change head shape. I have found in practice, and many other therapists have said this too, is that depending on the severity of the head shaping and or the head flatness, and depending on what other restrictions baby might be going through, it's very possible to continue with the head shaping and to make progress with conservative treatment and not have to go the helmet route past that 4 month mark, just depending on like different factors. So that's definitely something you can I would encourage someone to talk to like an infant physical therapist or like someone like me who's like virtual and in person too, to talk to about, just because it's one of those things that, if you're trying to avoid a helmet and your baby's 5 months old, it's very possible that you can still avoid that, even though like research typically says that it's not. Um,
Mhm.
but yeah, that's what I'd say about that.
Yeah, so around that point, kind of just start to get talking to physical therapists, and yeah, that would be a
Yeah,
good.
talking to physical therapists and then like also yeah, because it's like depending on the restrictions that babies are going through, it's still very possible that if you're noticing head flattening, that there's things that we can do not just related to positioning, that can really help with that head shape.
Absolutely. So I do have one more question for you.
Mhm.
What would you say to the mom who feels overwhelmed or like she's missing something because her baby isn't meeting milestones on time or on time?
Yeah, yeah. Well, first and foremost, what I would say is that coming back to ground zero and just thinking of like you and your space in the present moment. Is my baby well taken care of? Is my baby fed? Is my baby clean? Like all of the things that you would focus on just to like, make sure your baby is safe and happy and comfortable. You're doing all those things as a parent. And even if your baby isn't like happy and comfortable, you're still advocating for them and figuring out like what you need to do in order to help them at the same time. But with that being said, a lot of times I think that we can get really overwhelmed with like social media and the different advice of people around us. So kind of coming back into our own little bubble, taking away the social media, taking away like the outside advice if you can, and just getting back to ground zero of I'm here with my baby and my baby is taken care of. And that can take away some of that overwhelm of being like, oh my gosh, there's so much I need to focus on. There's so much I need to do. Your baby is okay. Your baby is going to be okay. And you're there with them. You're being a good parent just by being there with them. So I think that's just so important to come back to that ground zero and taking away like all the external noise when you do feel that overwhelm, because that can just add so much extra pressure onto your plate, especially as a mom, because we blame ourselves for everything. So I think that would be the biggest thing to focus on.
Yeah, I know that I myself, like even just through social media as a new mom, we see someone else's baby doing something before yours, it can feel like,
Hmm.
well, am I doing something wrong? But at the end of
Hmm.
the you're not. It's like,
Right.
mhm,
Exactly, exactly, and that's yeah, especially with, like, the milestone stuff, I know that it can be so stressful when you see, like, a baby, "Oh, that baby's rolling, and my baby's, like, older, then why is my baby not rolling?" A lot of the times, it's like, 1, babies they develop at different paces and different rates. And yes, like there are times when you maybe want to reach out to like a physical therapist or something to help. But with that being said, not everyone is the same. Not every baby is the same. And that's why I think that that's where social media can get really hard is like, I want to compare myself to this baby because I see them and everyone's happy. Why am I feeling this overwhelm and this stress? Like when I like with my baby and everyone else is so happy and like thriving and all the things, you know, Instagram and things like that are a highlight reel. So I think that just taking yourself, shut, even if you have to shut your phone off or whatever the case may be, and just sit there with your baby and with your little one, that can just take away so much of the overwhelm that you might be feeling. Get outside, get some fresh air. Babies love fresh air. That's another like
Mhm.
hack that I'll use is like if babies are really fussy, get outside with your babies into some fresh air if you can, and that will help reset both of you for sure.
Absolutely. Well, I feel like you answered all of my questions very well and gave us some really good tips that I'm sure all moms
Yeah,
will take something that will help them. So, and I appreciate your story as well. That was very meaningful.
yeah, of
So,
course.
yeah. All right. Well, was there anything else that you wanted to share with new moms, or I think we covered everything?
I think we covered most of it. I think that like yeah, I'm loving that you're having this space for new moms. I think it's so important because you know, especially in this day and age, in the age of social media and the overwhelm piece, it's so important to have that support in that village because it's not as common to have that these days. So
Mhm.
if anyone else is feeling like that, you're definitely not alone because that's how I felt as a new mom as well.
Me too. All right. Well,
Yeah,
much for your time.
of course. Thank you for chatting with me. This was great.